Welcome back. I'm Dr. Julia Strait. We're going to keep on going with part 2 of our trauma-informed evaluation practices in special education. So we've covered what counts as trauma in part 1. Now we're going to look at what are its effects on our students, more of a general sense, before we get into the individual this afternoon in parts 3 and 4. So, what are trauma's effects on students? What do we know about how trauma affects the body, our physiology, the brain, and our behavior? Everything has to go through these 3 stages, right? So we're going to look at research right from the beginning. How does it affect your body? How might that disrupt brain development and brain functioning? And then how does the brain affect behavior? First, a little context. How do we know all this research? Much of what we know comes from research on what we call adverse childhood experiences, ACEs. You might have heard it said that way. There are newer models of this, but these are kind of the original 10. So what happened was there was a doctor named Dr. Felitti at Kaiser Permanente Health System in California. He was doing bariatric weight loss surgery. He started to notice that many of his patients, particularly females, would lose a bunch of weight, and then they would put it right back on after the surgery. And he was kind of confused. And the anecdote goes, although I'm not sure if it's completely true, but the anecdote goes that, at some point he was doing routine intake paperwork, asked one of the patients, when was your first sexual activity as part of the medical background? And she said something like 12, or 7. And I remember hearing that he reacted really strongly and said, "What?" and started to look into what effects sexual abuse might have on some of his patients' physical health. And what we started to realize through research is that a lot of these people that were having these behavioral difficulties, which led to health difficulties, had a history of abuse and neglect. And so he started asking all of his patients in the Kaiser Permanente Health System, of these 10 things: physical, emotional, or sexual abuse, physical or emotional neglect, and then having someone in the home with a serious mental illness, someone who was incarcerated, watching their mother treated violently, so domestic violence, someone with a substance abuse problem, or divorce. Of all these 10, how many do you have? And, you can think about that to yourself. Many of us have one or more, but they started doing research, and they started to see that when people had one ACE or so, it wasn't really much different from people who had 0. 2, it got a little worse. And what you see is when people have 3, 4, and higher of these in their backgrounds, as adults, they tend to engage in more, poor health behaviors, lack of physical activity, smoking, alcoholism, drug use, and missed work. And then the theory goes that these things then influence physical health. So it was no surprise that these people had higher rates of anxiety disorders, impulse control problems, substance abuse, all of these different disorders. But the surprising thing was, oh my gosh, they also have more health problems like obesity, diabetes, and heart disease, things that we used to think were just influenced by physical factors. And now this kind of has reignited the whole mind-body way of viewing things in science for us, right? Like, how does stress affect our body, and how does that in turn affect our mental health and our behavioral health and our physical health even? So there are a lot of great studies on this, great books. Nadine Burke-Harris is a pediatrician who's now, I think, the first Surgeon General of California. She's great. She has a TED Talk you can watch about ACEs. But I just want to point out that most of what we know about this is from the study of these types of things, not necessarily, by the way, from COVID or other kind of single incident things like school shootings or hurricanes, because we know a little less about that. It's a little harder to research them. But childhood ACEs are a lot more widespread and therefore easier to study. So in Texas, just to give you an idea, you see there that nationwide, these are the number of people who have 2 or more ACEs from that list of 10. And again, there are more that are being added that are like cultural and racial discrimination and poverty and community violence, really important factors as well. But this is, I think, from the original 10 ACEs, what percentage of each population of each state. And you can see there that Texas is higher than the U.S. average. So it's higher than 21% have 2 or more ACEs in our state. So I want to also further point out that most of this research does not come from the household dysfunction side. This goes back to that discussion of what really counts as trauma, what's traumatizing. So a lot of our research on the brain and body and behavior comes from the abuse and neglect side. I guess I should do this because y'all are opposite me. But it comes from studying kids who we know have a history of physical, sexual abuse and of neglect, which I know when I first started working in with the foster care population, for example, that I was kind of like, well, neglect, I mean, what is that even? But we actually know that neglect has some of the strongest effects. Like 80% of CPS cases are from neglect reports, and serious neglect has some of the strongest effects on the developing brain. So, we don't want to discount that. And again, just to give you an idea of how many kids are we talking about here, first of all, remember that CPS referrals are usually an underestimate. These are the number of CPS referrals for different counties here in Texas. So you might see some of our counties on here. There's Harris County. And, we have around supposedly 6% special ed. This is according to TEA data. And then looking at DFPS data from 2015, in Harris County, we had 3% CPS referrals of all school-age children, I should say. And again, going back to our first set of slides this morning, it's really troubling that we think this is an underestimate, and during COVID, it is probably higher than this, the number of children experiencing abuse and neglect. But, you look at some of these counties like El Paso, I mean, very low proportion of special ed, very high proportion of CPS comparatively. So Nueces County, another one, about the same number of kids in special ed as who have been referred for CPS referrals. So I want you to just get an idea of like the percentage of kids we're talking about. And the other thing is that a lot of these overlap, as we talked about this morning. So kids with disabilities are more likely to be abused and neglected and maltreated. And often kids who are maltreated go on to develop disabilities later, which we'll talk about now. So what are trauma's effects on the body? First of all, let's talk about how we got this whole stress response system. My husband calls it the SRS. He says, Julia, your SRS is spiking when our kid is crying. And I know he's right? Because back in the day, however long ago, early humans evolved to have a very high alert system because we had things like bears and tigers and alligators and storms and all these things that could kill us. We didn't live past like 30. So we had all these dangers, physical dangers to our survival, our actual threats to our survival, to our life. Okay, actual or threatened death all the time. So basically, we needed a system that would respond quickly to this and allow us to get hyped up when we needed it and run, or fight, flight, or freeze, you may have heard. And then we needed another system to bring us back down after the threat was over, because living like this on high alert all the time is probably not very healthy, as we'll see in a minute. And so we, at some point, developed these two parts of our autonomic nervous system. And that's the sympathetic and the parasympathetic. So sympathetic, think of sympathy, like it's coming in. It's like, yes, it is really bad. I want to send an alarm to everything. This is the fight, flight, freeze. Your heart rate starts racing. You're sweaty. You are nervous. You get tunnel vision. You have to focus. All the other functions of your body shut down, digestion, everything. You're not interested in sex. You're not interested in digesting things. You're not interested in rest. You are interested in solving this problem right here in front of you, right? Sounds kind of like anxiety, huh? Okay. But it's not good for you to have the alarm going off all the time. So we need the parasympathetic nervous system to come in. And I think of paramedics. And, you have this picture here of this teddy bear being soothed. This is our kind of soothing system. It's like, okay, the threat is over. Turn it down. Turn the siren off. Let's go back. Get some rest. Let our system recover. Digest our food. Focus back on the whole environment. Be more open and calm and nurturing and focus back on reproducing and eating and all those things that we still need, because we're away from the threat now and it's over. So what happens is in our bodies, just like every other hormonal system, we have this feedback loop. Our body feels stress. Part of your brain releases some different hormones that signal our body to release cortisol. You've probably heard of cortisol, like the stress hormone, right? So high levels of cortisol and adrenaline start circulating all throughout your bloodstream, telling everything to turn on, siren, right? So usually we have a switch, a negative feedback system that says, hey, okay, threat is over. Everybody go back to work. Like cortisol stops circulating. We turn the switch and we are able to rest and digest again, right? The problem is that when you have chronic trauma or toxic stress all the time, your siren is running all the time. You have high levels of cortisol and adrenaline circulating. What happens? What happens in the summer in Texas when your thermostat is running all the time because it's 105 degrees outside, right? A lot of our thermostats break because they just don't, there's no variability there. It's just hot all the time, and so they're pumping and pumping and pumping. And at some point they just say, oh, I give up. I can't do it anymore. And so the whole system gets broken. What does that do to the body? You can't turn your stress response system off or on. So you might see two different reactions. You might see hyperarousal, which is like constant vigilance, heart rate all the time, alert. You also might see hypoarousal in some kids, numbing, shutting down, okay, not wanting to do anything, not wanting to talk, just total shutdown, right? So that's two different ways it can go, but it's both a result of the same kind of mechanisms where your whole system is flooded with this 105-degree heat all the time, You either start going crazy trying to fix the thermostat all the time, or you shut down and you just say, I give up. I'm going to lay down and just be hot. Okay. Heart rate changes. So we know that when you're excited or when you're under threat, you have high heart rate, right? Your heart races. But what's more important, we think, is heart rate variability. That whole responsiveness. Your heart rate should be high when there's a threat and calm back down when there's not. So most normal, healthy people have this, variability. It's normal to go up and down, up and down. These kids, if they're hyper-aroused, it might be all the time. If they're hypo-aroused, it might just be low all the time, and nothing really gets them all that excited. So there's actually some interesting research, too, that I just heard about coming out of Menninger Clinic, where, by just sidebar, autism, kids with autism a lot of the times have heart rate variability problems where their heart rate is just always really high and hard to regulate. So same kind of thing. This might look in a kid like a high startle response. So someone who's very jumpy. I mean, obviously all of us jump if you tap us and we don't know, we're not looking. But these are the kids that jump out of their skin whenever you call their name, right? Or again, the opposite could be true. They're just totally numbed out. Nothing gets to them. You might see this come into the body also as muscle tension, complaining a lot of headaches and stomach aches, wanting to go to the nurse, which could have an avoidant function as well. But a lot of the times is legitimate pain. We just saw in those ACEs studies, right, that it can affect your body. All that stress literally does build up in your body. So these kids might spike high, let's say, on somatic complaint. All right, those are all physiological body things. What does it do to your brain to have all these things going on? Well, look, here are some, now granted, these are rat brain cells from the hippocampus, which we'll talk about in a second. It's a part of the brain that's responsible for learning and memory and consolidating memory. They took some neurons, some little brain cells from rats, and they bathed them in these stress hormones, cortisol and adrenaline. Kind of for a very long time. And so you'll see on the pictures there's the control versus the early life stress condition. The control was not bathed in cortico-releasing hormone. I think that's what CRH stands for. And the other one was bathed in it all day long, every day. And you see that the little branches of neurons, which if you know basic, neurology, there's the little cell of the neuron. The little branches are called dendrites, which literally means branches, and that's how the connections in your brain start to form. Well, when you have early life stress, there's fewer connections. They're looking kind of scraggly. They don't work as fast, right? They don't grow as fast. You see on the bottom there, they actually lose the little red areas. There is a loss. Even after, this is 5 minutes, 30 minutes, right? There's a loss of these little buds of dendrites trying to grow. And this hormone disrupts all that. Pretty scary. So this is my beautiful diagram of a brain. I couldn't find one that had exactly what I wanted. So I'm going to show you the major highlights of what research we have on brain changes. Again, noting most of this research is from abuse and neglect. So it doesn't always necessarily generalize to, single incident trauma or anything like that. But we do know in general, these are the kinds of changes that happen. And we think that it's a difference of degree rather than kind, which we talked about this morning, where probably it's just less of this going on in a kind of a less traumatic experience, not necessarily a totally different thing going on. We also know that, again, those vulnerabilities that we talked about, like having a disability, already having trauma, already having high levels of stress, already having anxiety and depression, would, of course, make it worse. So we know that in kids who have been abused and neglected as children, they have a decreased volume, so smaller, this red part right here, the hippocampus, which is responsible for learning and memory. We call it the Wikipedia of the brain, right? It takes all the little sensory information and everything, and it wraps it up nice and stores it into long-term memory, and then later it helps get it back out. This is very disrupted in development when you have trauma. So those little hippocampal neurons we just looked at were bathing in the stress hormone, and they weren't branching very well, so it doesn't grow as big. Your amygdala or amygdalae, there's actually two little almond-shaped things in your brain in the limbic system, which is kind of our emotional system. This is the yellow part in the diagram right here. And this, in kids who have been abused and neglected, is often overactive and larger than in other kids' brains. This is responsible for processing new things, novelty. Any kids that are, having trouble with change, threat assessment, and remembering and recognizing different emotions and emotional events, storing emotional memories. So in PTSD, sometimes you have people who say they don't remember what happened, and that's valid, right? Because the stress may have disrupted that memory, and the amygdala has a part in that. And then it also deals with stress regulation. So all of these things are messed up sometimes in trauma. The prefrontal cortex, this is a big one. We call it the PFC. It's kind of the home of the executive functions, right? We hear a lot about executive functions, another area that I train a lot in. Executive functions are things like inhibiting your responses, paying attention, working memory, holding a lot of information in your brain at once, and then cognitive flexibility. Again, being like adjust to changes, pick this thing, pick that thing, make a decision, right? The frontal lobes in general also are responsible for all your abstract thinking. So your kid that's sitting in geometry class, right? Cause and effect, those kinds of thoughts. And then language and speech. So there's a lot of language and speech processing that goes on here in that frontal lobe, and that can be disrupted as well. So the prefrontal cortex maybe isn't necessarily smaller or anything like that, but the big thing about this is that in kids with early childhood trauma, we know it's kind of knocked offline. So the connections between the PFC and the limbic system, the amygdala, the hippocampus, all the kind of emotional parts, the hormonal systems, is knocked offline. So they don't communicate so well. So it's not able to kind of come and cover up, some of that more emotional thinking. It's all this reactivity and emotion going on in the limbic system. And the prefrontal cortex usually can come in and help kind of cover that up, slow it down, soothe it. But in these kids, like that connection is not there. That doesn't mean it's an excuse, right? Like, we're going to get to this, but we need to help them kind of reclaim that connection. And overall, kids who've been abused and neglected have decreased brain volume. Their brains are smaller. There are fewer connections overall. You saw why the dendrites don't branch as much. There's less myelination, the fatty white part that goes around, like the plastic on your cords that makes transmission faster for your, Wi-Fi, or not your Wi-Fi that has no wires, but for cables, right? It makes transmission faster. This slows it down. It's less efficient. It's like a sparky old electrical system. All right, what does this look like on an IQ test? Again, so this is from meta-analyses and research that mostly focuses on kids who are abused and neglected. So I want to clarify that. Many of them will have lower overall IQ. You may ask, well, how much lower? It really, really, really depends on all those factors we talked about this morning. Their vulnerabilities, their existing IQ, heredity is still part of it, right? And that's, by the way, why we don't look so much at the household ACEs, because it kind of gets mixed up between like what's in this kid and what's in the household, and that gets very confusing. So we're going to stick to the ones we know about, the abuse and neglect experiences. We also know they have poor verbal ability, language, and comprehension often than kids who have not been abused and neglected. So think about that, like that hippocampus and that frontal lobe not working so well. We're not getting the language development. It's more likely that these kids have speech and language problems when they're younger too. Again, some of that is hard to tease out versus the environment, because they're maybe not, they may be also losing opportunities with their parents to interact and read and things like that if, they're not getting that rich environment. But some of these studies even control for that, and we know that they may have lower scores, let's say on like verbal IQ or verbal comprehension indexes. And then overall slower processing speed, so that GS or the PSI on the whisk, right? We might expect, just like an ADHD actually, this is looking pretty ADHD, isn't it? Slower PSI. They may also be more distracted during those tasks. And then the dark purple are all executive functions, but they're important because they will show up both in your observations of testing and in the scores. So these kids are, it's harder for them to inhibit unwanted responses. Okay, so they may be self-correcting a lot, like blurting out an answer. If you give them a neuropsychological test of response inhibition, like the NEPSI or the DCAFs, they are going to have trouble with that usually. They have poor working memory, so the working memory index on the WISC, and poor attention overall. You might notice more distractibility during the test, again, during observations. If you directly test attention with like a continuous performance task, you might see lower levels of attention. And then poor mental flexibility. So being really rigid, not wanting to start over, wanting to like finish the whole thing. And then on the NEPSI, there's some tests of like switching or flexibility, and they will do usually poorer on that than kids that have not been abused and neglected. What does that look like for academics? So a lot of these children from very early on, they have delayed language. So when I worked in Memphis at the Center of Excellence for Children in State Custody, we saw a lot of 3 and 4 year olds, and many of them had this kind of delayed speech and language. Partly part of the environment, yes, but also partly because of the brain disruption, the development. And then their adaptive skills. So think about what adaptive skills are tested on the skills that we give out, right? Like the ABAS or the Vineland, we're testing, how do you adapt to change? How are your social skills? Like developmental milestones get disrupted. They're not achieving at the level that they should, even from a very young age, preschool. Of course, grades are going to be lower. So this is all, by the way, from a meta-analysis by Michelle Perfect and her team. It's called School-Related Outcomes of Traumatic Event Exposure and Traumatic Stress Symptoms in Students, a systematic review of research from 1990 to 2015. It's in the journal School Mental Health, and it is wonderful. It shows a giant chart of all the school-related outcomes of abuse and neglect. And so she showed that those kids had lower grades overall. State standardized test scores, okay, like the STAR, are lower. Reading and math scores on standardized tests like the WJ. She saw anywhere between, I think, 6 and a 20 percentile rank point difference between kids who have been abused and neglected and kids who had not. So at 6 percentile rank points, you're not worrying too much. But at 20, depending where that is on the curve, you might be a little bit worried. So you might expect these kids to have lower grades. They are also more likely to be retained in their grade, which we know from lots and lots of research is usually not effective. And by the second year, any gains are lost and also makes them more at risk for a dropout and things like that. Just a side note. But they are also less engaged in school, less involved in activities. They are absent much more often. They have higher levels of truancy. And again, because of all these things, probably, they're much more likely to drop out than their peers. The one interesting thing for us is that they're also overrepresented and underrepresented in special education depending on what category you look at. So usually kids with abuse and neglect histories are overrepresented in categories like ED because, we put them in the behavior classroom. We think it's just behavior. And sometimes that's fine and that's helpful. But a lot of times they're underrepresented in categories like ID and LD and speech. Because we have this kind of diagnostic overshadowing where we attribute everything they're doing to their behavior and their emotions, right? And some of that is disruptive, but some of these kids do have legitimate cognitive disabilities. In fact, again in Memphis, we did a little mini study that we didn't publish, but it was of all the teenage kids we had seen, how many of them came in for behavior concerns. And a lot of these kids were kind of the worst of the worst, like, they had assaulted people and had these horrible histories. And most of them either weren't being served in special ed or they were expelled or suspended. But there was a huge percentage of them that we diagnosed with intellectual disability for the first time, meaning no one in their entire school career had caught that these kids had IQs like in the 60s. We weren't talking like borderline. We were talking very low, some of them profoundly intellectually disabled. And nobody caught it because there was that overshadowing of the behavior. So just to keep an eye out for that. All right, so that's the body and the brain. Let's look at behavior. And by behavior, I mean anything that we do. So in contextual behaviorism, which is kind of the new behaviorism, right? Contextual behaviorism says that not only our outward actions, but our thoughts, our feelings, any event is a behavior. So I'm going to be talking about both mental health as behavior and kind of acting out, right? So let's go back to the brain. When you have high circulating levels of cortisol and adrenaline, you're going to have high alert all the time. You're going to have high reactivity to everything emotionally, behaviorally, unless you're one of those hypoarousal kids, which will be numb, right? But that acting out, this kid acts out, right? He acts out. Of course, his brain is all messed up. That switch is broken, right? And again, not an excuse, but an explanation and something to help us with Rex later. And that higher arousal level, always being on alert, threat detection, always scanning the horizon for a lion all the time, that is going to get really exhausting and can lead to anxiety. And what we sometimes see is that the anxiety is running for so long that it then leads to depression. Because your brain is just like, oh my God, I'm on alert all the time. When is this going to end? You start ruminating, which is something we'll get to in a minute. What about that amygdala, right? Or those amygdalae, the yellow part, right? It's overreacting to change and novelty. Everything is a threat. So your friend on the bus, says something to you as a joke. How many times do we see these kids referred because they beat the crap out of someone for calling them names or whatever, And it's like, whoa, that was an overreaction. And, in our AD criteria, it says like under normal circumstances, whatever that means, they might have feelings that are blown out of proportion. Well, these kids will, and they will act on it sometimes, right? They have a lot of trouble identifying and recognizing emotions, both from facial expressions, but also other nonverbal cues, like posture, social distance, or not social distance, I guess social distance, physical distance from someone else. And if you have trouble recognizing emotions in yourself and others, you have trouble asking for what you need. So self-advocacy skill is one of those adaptive skills on the ABAS. And you also are going to have some social skills problems because it's going to be hard for you to interpret other people's cues. You're always thinking people are threatening you or out to get you, or you're totally numbed out and you're withdrawn and you're not going to talk to anyone, right? So these are some things that can happen. There is some evidence of disruption in what's called the basal ganglia, which is part of that limbic system. This is really interesting to me, that some kids who have really severe abuse and neglect histories have weaker reward processing. It's like they don't respond as you might expect them to rewards. Like, have you ever said, like, good job? And the kid's like, stop it. Don't tell me that, there could be some other emotional and cognitive things going on too. But a lot of times we know from research, these really interesting studies, that like you reward these kids and they actually don't learn as fast from rewards or punishments. There's also literature that kids with ADHD are a little insensitive to punishment. Like there's some dopamine things going on there. This is the same in kids with trauma. So they're not going to respond as you expect to punishment or reward. That doesn't mean we're going to stop doing it. We're going to try and find things that are rewarding to them, which for these kids is very often social connection. Or food, or if they're neglected, that could be very rewarding. But we are going to find a way to work with this. Right alongside that, like this dopamine issue, right? They're more sensation and excitement seeking. Everything, especially if everything kind of seems dull and there's no real change ever, your heart rate is kind of the same all the time. You're either on alert or you're hypo-aroused where you're numbed out. You might be sensation seeking. You might want to, go do extreme sports or, we hope that that's the choice, but sometimes it's drugs or doing risky things, risky sexual behaviors, for example, right? It's like if you're numbed out, you're trying anything you can do to feel something. And your prefrontal cortex, right? So these kids have a lot of trouble making good choices, exerting self-control. Remember, that top layer of the brain is not there to kind of keep everything in line. Not an excuse, an explanation. It takes them longer to calm down. That self-soothing system that's usually there, the interaction between the prefrontal cortex and the limbic system, saying like, it's okay, remember we can think through this, that physiological sense that everything's okay. How are you going to calm down when you got cortisol and adrenaline racing through your blood all the time, right? It's very hard for them to calm down. They can get very dysregulated very quickly, and they can stay dysregulated for a long time. And maybe more impulsive, attention-seeking, and easily distracted, which is what we just talked about, right? Again, this is sounding a little like ADHD, and we'll get to that in part 3, but a lot of the symptoms are the same. A lot of the physiology is the same. Increased rumination, so worrying, thinking negative thoughts, all these types of things. Sometimes you see this. You may not see this in your acting out kids because you're so busy dealing with their behavior that You don't think about the internal stuff that's going on. But some kids may be having this too. They're likely having this. And even in kids that are not acting out, maybe they're not paying attention in class because they're constantly worrying or thinking about like if their mom is safe or whether that's going to happen again. A lot of that distractibility may be cognitive as well. I would be remiss if I didn't mention the attachment piece. So early relationships obviously are going to affect your behavior and your brain. All the things we just talked about the brain and physiology, of course, that's the pathway. But what does it look like when you're little and you're learning to build relationships with someone? And your model for that is these, caregivers, your parents, who, instead are not to be trusted and are, abusing you or neglecting you. That can be really confusing for kids. We know that interaction with parents builds brain connections, but abuse and neglect tears them down or doesn't allow them to expand in the first place. We also know that self-soothing is first learned via co-regulation. When your baby cries, you pick them up and you rock them and you say, it's going to be okay. And you say, shh. I'm convinced that part of that is to calm yourself down, right? Like, shh, okay. But you're co-regulating. You're both worked up. Your SRS is on alert and you're co-regulating. And that's how you teach your baby to regulate themselves. Eventually, when they're a little older, my kids aren't there yet, but I'll let you know. Maybe when they're teenagers or, in their 20s, they learn to regulate their own emotions a little better. So we have to help them with that sometimes because those early relationships maybe weren't there or weren't great models, right? And speaking of which, modeling appropriate boundaries. This is me and this is you. These are my feelings. These are your feelings. This is my body. This is your body. So that sometimes, of course, is not explicitly taught to all of us, but in the way that our parents model things and interact with us, these things develop kind of organically. And a lot of kids that have this complex PTSD, this early trauma, are not getting this. So I want to note, this isn't, as likely if you're looking at something like a school shooting or something that's not really relationship based, but a lot of the stuff we're looking at is about abuse and neglect because that's the most common, probably the most likely to lead to disruption of development. The picture there is of Harlow's monkeys, so you might look this study up. There's some really nice videos about it on YouTube. But basically they put these little baby monkeys in a cage. They gave them a wire mother that had food and a cloth mother that didn't have any food. He just had comfort. And you can see that the babies by far preferred the comforting mother. Right? They needed food, but this little monkey in this picture is actually trying to stay on the mom as long as possible, even though he needs food. So it's really cute, but in a way it's also really sad. Think about these kids, right? They're growing up without maybe that cloth mother there. And it's I want to emphasize too, it's not necessarily a parent's fault. We don't demonize these parents. That's a whole nother workshop, but a lot of this is intergenerational. They have 4 jobs, they themselves can't regulate. They've got substance use problems. I'm not saying that stuff is good. And I'm not saying it's a teacher's job to fix all of that stuff. But I think it helps to know the context, right? So these wire mothers, nobody wanted to be a wire mother. Nobody wakes up and says, when I grow up, I want to abuse my children. So I want to make it clear that I am not blaming anyone. Many of these mothers and fathers also have intellectual disabilities themselves or are low functioning. And they don't have, the skills to inhibit their reactions, to regulate themselves. They were treated the same way, and they have no resources. So I want to make that clear as well. So there's this guy, Paul Gilbert, who does compassion-focused therapy. I just want to throw that out there real quick. Think about this model, right? This isn't biologically necessarily true, but think about, he says there's 3 systems in us, right? Threat system, our soothing system, and our drive system. Threat detection system, you can guess, in kids with trauma is on alert all the time. That's self-criticism, the anger, the acting out. They're always protecting, If they're stuck in that and it's off balance, then how are they going to activate this drive system where we want them to motivate, get motivated, achieve, be focused in class? That is very hard to do when your threat system is the one that is taking over. What do you need to balance that out? You need your soothing system. We just talked about how sometimes in kids, who grow up in hard environments, or even kids with single incident trauma who, maybe their parents died unexpectedly or something like that, co-regulation, that soothing system is not online fully. It may be off balance. So you want all these systems to be in balance, and within each system, they have to be balanced too. That's kind of a whole nother thing. But think about this, right? If you're focused on threat detection all the time, you're not able to soothe yourself. achieving, like getting good grades, just may not be that important. So last thing about what affects behavior, of course, all these physiological and brain things lead to some thoughts that may be unhealthy as well. Some core beliefs that kids may develop, unconsciously maybe, right, as they develop. One is the world is not a safe place. Connection with people is risky. And sometimes connection is really messed up because it's like love is being hit or being sexually abused. That's very confusing, right? And the other one is kids that have abuse histories have impaired what we call delayed discounting. The idea of like, I'll give you $2 today or $40 next Wednesday. Now, many of us who have online executive functioning would be like, $40, of course, that's more. Kids who have been abused and neglected, they have all that physiology stuff going on, the brain, the PFC is knocked offline, and it's like, whoa, I'm in the savannah again. There are tigers. I don't know when I'm going to get food again, so I'm going to get what I want now. I'm not going to wait till next week. And on tests where they offer them this different amounts of money and everything, kids with these, ACEs, higher ACEs, they respond that way as we would expect. They want it now. So think about that, like the kids that are, stealing food. They don't care about the consequences. You're like, think about the consequences. They're not, because they're prioritizing the right now. And in some ways, in some environments, that might be adaptive. It's the same thing with sensation seeking, sex. If you're not going to live very long, you might as well get everything you can now. And that's the way their SRS systems are tuned. I just want to mention here at the end that COVID-19, not much is known about the effects on our mental health and behavioral health or physiology, but there is one study of some kids in the Hubei province, I'm probably pronouncing that wrong, where the disease first, was discovered, or there was the first outbreak after just a month of quarantine, an average of 33.7 days for these kids. In a sample of a couple thousand, 22.6% were already showing depressive symptoms and 18.9% were already showing anxiety symptoms. So just something to think about, thinking about the base rates of different things. Like, how common is this? What am I looking for? We might be looking at some kids who come back pretty depressed and anxious, even if they don't count as traumatized, right? Okay, you're looking at your BASC or, your CBCL or whatever you use for behavior checklists. These kids are going to have higher levels of psychiatric disorders, right? Like the externalizing ones, ADHD, OD, conduct disorder. The internalizing ones, anxiety and depression and PTSD, right? They're going to have higher levels of all these diagnoses or symptoms. Think about the whole attachment thing we just talked about with relationships, no role models, no self-soothing, hard to interpret people's emotions, everything's a threat. Okay, they're going to have poor peer relations. Their social skills are going to be, it's going to be a challenge. And reduced pro-social behaviors. So not just looking at the negative, but the positive, right? Like the side of the BASC where it's like the adaptive, peer behaviors. They're going to have lower like leadership, all those pro-social types of things, self-initiative. And of course, more discipline referrals because of that acting out. More suspensions are more likely to be suspended and expelled than other kids. And that's controlling, again, for a lot of other things that you might say, well, what about this? What about this, right? So that's controlling for a lot of these. These kids will have higher levels of these things. Okay, so those are the effects on the body, which moves to the brain, which moves to behavior. And by the way, it's a feedback loop too. So, right, like you're acting out all the time or you're numbed out or you're sad, whatever, that goes back into your body to create more stress, which then affects your brain again, which then affects your behavior. So it's this really mean cycle. And if your switch is broken, you can't turn it on and off, it produces even more of a problem. Luckily, we know from research and from practice that there are things we can do to address all of these effects on the body, brain, and behavior. And we know the first step to addressing them is to get a clear evaluation of which effects are actually impacting this child right in front of you. And so the next section is going to be about, has this child right in front of you that you're evaluating been affected by trauma?